Hello from Mocom Australia. We've done a video series on how to hibernate the Mocom equipment, so the Mocom sterilizers and underbench washers and on-bench Tethys H10 washers. So that was aimed at how to hibernate the equipment so that it's safe, the user maintenance is done, and the equipment's ready for you when you're ready to open your doors. This next video is more aimed at compliance and keeping that compliance up to date, because we see a time where all of the practices around Australia, we're looking forward to it like you are, everyone will be opening their doors perhaps at the same time. There'll be a surge of compliance work to do, and still the same finite amount of technicians around Australia and New Zealand to carry out that work. Some practices have elected to keep their doors open and to allow those essential validation services to keep rolling. So that doesn't apply to you. But if you've had to physically close your practice down and you intend to reopen when the government tells us all we can work again, then the challenge there is the validation and the operational qualification of the machine still in date? And if it's not, even if you're quiet, that won't be compliant. Now, there are a couple of workarounds. There's the AS, for the office-based practice at least, the AS 4815 2006 has a clause. If you'd like to read up on 7.3.1.3, where it talks about the accessibility of technical support. So within that, there's a clause that says you could use a Class 6 indicator within every pack, within every load, if technical support's not reasonably available. So that's a workaround, but I think the biggest tip that we could give is that rather than wait until you want to open your doors for that essential and mandatory test work to happen, perhaps consider bringing forward that validation or that compliance work well before you want to bring patients into your practice, so that we can be well ahead of that surge.